And in this case, what we have been saying, and consistently, is that if you try to scapegoat or individualize this as a problem simply of undocumented migrants, not only, as you mentioned, are you violating our constitutional law and acting illegally, this needs to be clear, but I think more appropriately, what you're doing is you're not going to deal with the situation. If that is a concern, then let's look at where the real crisis lies within our healthcare system. I want to give one example that is appropriate in the relation to the link between the blaming of international migrants and the healthcare crisis. If you remember, and listeners and viewers would remember, about a couple of years ago, Popi Ramatuba, the MEC in Limpopo, the health MEC, was caught virally on video, basically haranguing a Zimbabwean woman and saying, "You're overburdening our healthcare system. You should go back home," and so forth. And this caused a lot of controversy. What was then came to surface a few months afterwards when we did our research was that the Limpopo Health Department had over 150 million rand of unexplained and misappropriated expenditure over the last 3 years under Dr. Ramatuba's basically leadership. So what we were saying then is that if you go and you blame the Zimbabwean woman for basically causing this crisis, you're missing the larger point, which is that there are serious problems within this healthcare system and the management and the use of that money that is preventing people, including all South African citizens, from getting the necessary care. So that's the larger point that we're making here.